children. Unfortunately, death can happen in children. The majority of causes are accidental: noyade, drowning, accident, infection. But some of those deaths can be sudden, and they can happen, but not as frequently as in adults. You see, the numbers are very, very much lower than the number that were presented today. They happen about in a quarter of the time during sports. So most of sudden death in children will be during sleep, or we don't know when. Whoop, the pictogram don't show, but they happen 2 times more frequently in little boys than in little girls. In the patient I do follow in clinic, the patient with congenital heart disease, they have a higher rate of sudden death, even in the pediatric ages. There's like 2 ages where sudden cardiac death happen in children. These data come from people in Denmark. Do they our work? No. So they have a peak in very, very young babies, what we call the sudden cardiac death syndrome in babies, and then it will rise up afterwards during adolescence. So we're not going to go on and talk about the sudden death in babies. Fortunately, these numbers have decreased a lot in the last year with dodo sur le dos, sleeping on the back, but we still see families who lost a baby, and we're trying to find the cause of this death. So what are the causes of sudden cardiac death in children? You see in this list nothing about coronary atherosclerotic disease. Children don't have atherosclerotic disease, but can have other kind of disease who are the cause of their death. And the most frequent cause of sudden cardiac death in children is hypertrophic cardiomyopathy. And then you have those congenital coronary artery anomalies we heard from Dr. Baggage early on, the Marfan, some congenital heart disease, and then you have some arrhythmia problems. And there's also a number of patients where we don't find the cause of that. So we know a little bit, we know they are there, but there's many, many things we don't know about sudden deaths in children. And we talked a lot about those things today. How do we screen that? How we do the reanimation with all the emergency medical services and AEDs. But also, we should think about what do we do when you have someone, a family, who had a sudden cardiac death. What do we do with the living relatives? How do we screen them? When do we do a molecular autopsy? We're talking about that, but we're not ready yet to implement all those things in all the population. And how can we prevent those sudden cardiac deaths in children? Is there some children we can pick and tell them, don't do this sports, but do we do more harm by restricting them than having them do some sports? And then finally, some ICDs can be implanted in children, but to whom do we do it? If we do it, can they still do sports? So there's still a lot of question unanswered in this topic. Some people have raised this very nice cartoon. This comes from BC. Shusha Natani, a pediatric cardiologist over there, was in this panel. And they proposed that in children that with an underlying condition, we should propose them to do some sports safely. So swim supervised, don't drown. The plan for emergency, make others aware, rest and report when symptomatic, take medication as prescribed. Adolescents don't take their pills and stay hydrated. So these are the things we can propose to our little patient. And these things about reanimation, we discussed it a lot today. But now I'm going to switch gear because I knew everything I just told we would have heard about it. And I want to talk to you about physical activity in children. The benefits of physical activity in children are tremendous. They are tremendous at every age, but in children, they are the most important thing for their development. And if they don't move as children, they will not become good adults and good productive adults. So the benefits of physical activity, the physical fitness, the motor competence, weight status, metabolic health, arterial characteristic, bone health, academic achievement. If you want to be good at school, don't take Ritalin, go run outside. Health related quality of life, brain and mental health, and the list goes on and on and on and on. So kids who move and sweat have healthier brain, they are brighter and they do better in school. So kids has to move. This is a cornerstone in their development. The Canadian Society of Educational I don't know how to pronounce all those words. Anyway, you know about this. So they made some recommendation for children to move, and they divided in four things: the physical activity, sedentary behavior, and the sleep, and what at every age child do. So in young one, babies under 1 year of age, they should do 30 minutes of tummy time. If you had little babies recently, I'm a grandma, so I had a little one recently. 30 minutes of tummy time below 1 year of age, it's a long time. They don't like it, they yell. After that, they can walk, and they should do 180 minutes in many activities with a variety of intensity. It's 3 hours per day. When they are between 3 and 4, still 3 hours and at least 60 minutes of very energetic play. And between 15 and 17 years of age, at least 60 minutes per day of moderate to vigorous physical activity. And they should do muscle and bone strengthening at least 3 days per week. Do they do that? What do you think? No. Less than 1/4 of children between 6 and 17 years of age do their 60 minutes of physical activities. 26% of high school students do their 60 minutes. And then 51% of high school students do the muscle strengthening they are supposed to do. So children don't move that much. Recommendations are there, but they are not followed at all. And why they don't move? One of the reasons is that they are in front of a screen. There's also screen time recommendation. We want them to move, but we don't want them to be sitting too long. So for children under 2 years of age, screen time is not recommended at all. If you see a tiny one, you take out your cell phone, they are already in there. They know what is a cell phone. They know what, and they're really attracted with that. So they are attracted with the screen time. Between 2 and 5 years old, only 1 hour per day. 1 hour per day is very not a long time. You preparing the dinner is so fun to put them in front of passe-partout we have in Quebec province. So they do much more than 1 hour per day. And then when they get older, it's 2 hours it's 2 hours per day. So for adolescents and up to whatever age, 2 hours of less per day for teens on the screen. But teens are not only 2 hours per day in front of their screen. You see this number, 7 hours and 38 minutes per day on their screen, on their phone. So that's the reality, and that's what we have to fight today. And then what happened if they don't move? They get obese. The obesity rates among children and youth in Canada has nearly tripled in the last 30 years. The children and the youth are obese, and you know that they will develop many, many problems with this obesity. So children should eat more 5 veggies per day, no more than 2 hours of screen time, 1 hour of physical activity, and no sugar drink. So that is what is recommended, but that's what's not done. So there's some people and there's some things done to help to move those kids. And I'm going to show you some examples. We have the province of Quebec. This is Pierre Lavoie. Pierre Lavoie is a triathlete who lost 2 of his kids from lactic acidosis. And Pierre Lavoie decided to raise money to help to find a cure for this disease. So he makes big tour. They tour in cycling in the province of Quebec last days, and he raised millions of money. But what he did for me, it's very important. And he invented this energy cube. So they go in school, and every child who does 15 minutes activity has one cube of energy. And then kids will collect a cube of energy. They will ask their parents to do it, and they do race between schools. And then you have this school is the biggest school. They build bigger blocks, and this make kids moving the school in the province of Quebec. That's really a wonderful program. Another program, you know, Dr. Laurent Duvernay-Tardy, a football athlete who is from McGill. Sorry, it's not from University of Montreal. So he did his medicine at McGill, was recruited in the Kansas City, is playing football. But Laurent, aside from his medicine, is in football, has his own foundation. And he called it Move with Laurent Duvernay-Tardy, Bouger avec LDT. So he goes in the province during winter because he's not playing football. And then he goes to school and he make exercise with kids. They even cross Gaspésia walking on snow during winter. And kids are amazed with this huge, tall, fit guy who comes in and tells him, you have to move. I could not refrain myself from showing you a picture of one of my patients, VHD closure, in the hands of Laurent when he came to visit us in Saint Justine. And today, I was supposed to be in Montreal, being at this race. This is the Foundation of Children with Heart Condition. And today they were running 6 hours. Why 6 hours? That's the time it takes to do an open heart surgery in the kids. And they are raising money for that. But this year they had a race for those little ones. Those little ones with heart condition, or the brothers or the sister, ran also. So exercising those kids, they really want to reinforce that. So to conclude, Canadian kids are sitting too much and moving too little to reach their full potential. We should promote physical activity and certainly not restrain our little ones. Thank you.